This is the second year of our conference partnership with Social Care Wales, and very pleased to be sharing the platform with the new chair, Mick Giananski, who is sitting down there with Sue at the moment. From my initial conversations with Mick, I know that he's very keen to bring new insights into the field of social care and to make a positive contribution in promoting the sector right across Wales. So ADSS, we look forward to further strengthening our relationship and work with Mick, Sue and the whole of Social Care Wales. It's always a great opportunity, the conference, to showcase the quality and excellence of the work that frontline practitioners undertake across Wales, and even more importantly, to listen to the stories of those we are privileged to support and serve. It's also an opportunity to listen to contributors and visit exhibitors beyond our borders, to learn about academic research and models of best practice elsewhere, which may have the potential to shape and enhance the important work we're doing here every single day. It's a networking opportunity for the whole social care sector in Wales, with something for every care workforce member, from those who work on the front line in social services, social care, early years and childcare in Wales, to directors and senior managers of local authority social services, as well as the social work and social care students. I think it's really, really important that for us as a sector, we keep talking, we keep learning and sharing, because in the future direction, the stakes our sector have to face will be so high, never been higher. The sector continues to generate a high level of media and public exposure, and the value and importance of social care to our citizens and our wider society has never been higher. A year on from A Healthier Wales, we continue to work with our colleagues in the NHS in paving the way for a more integrated health and social care system, one that is based on prevention and early intervention and away from unnecessary acute care. A key element of accelerating that cultural and structural change is the government's Transformation Fund. Over the last year, local authorities have played a critical role in shaping the 12 projects which feature across all 7 regions that have been agreed by ministers so far. And we had a very good workshop on that yesterday. It was absolutely jammed-packed, chaired by Councillor David from WLGA. So I hope those of you that were able to go into that enjoyed that and had an understanding of what's happening across the whole of Wales. The partnership projects, we've got a real opportunity here to harness skills, knowledge and experience across health, social care and third sector to radically redesign the way organisations operate and the way that services are delivered for the benefit of Welsh citizens. Social and preventative services play such a crucial role in caring for our population, keeping people where they want to be, keeping people well in their own homes, with their families and in their own communities. It also connects people to those wider factors that keep people well, such as employment, housing, social interaction, friendships. And that's something we know is important now more than ever. However, while there will always be new ways of working, forged by new research or new technological advancements, we should never forget that social care is fundamentally a relational business. We look to build trust, rapport and relationships over extended periods of time to ultimately change and improve lives. And for me personally, nothing is more important than building that relationship. Resources are reducing. We've got greater demand but less resources, and I'm sure that Councillor David, as WLGA spokesman, will say something about that later on. I believe it's our moral and professional duty as social care practitioners and leaders to not only give of our very best on the ground in our communities to make change happen, but to also advise and guide our elected representatives so that reforms can be found and progress can be made in ensuring the long-term sustainability of our health and social care system. I'm extremely proud of the work ADSS Cymru is doing in this regard, not only to raise awareness and lead national policy debate about challenges and opportunities within the sector, but also to be practically involved in creating positive, workable solutions. The depth and knowledge of our members and experience is considerable. That's why our strategic aim is to harness and utilise that wealth of our members' experience and expertise, working in partnership with other agencies to influence important decisions around social care to the benefit of the people we support and the people who work within care services. ADSS are proactively involved in a number of areas, for example, the Ministerial Advisory Group on Improving Outcomes for Children, as well as the Looked After Children Technical Working Group, working with Welsh Government on solutions to mitigate the further rise of children entering the care system. ADSS are also currently involved in several other working groups established by Welsh Government through the Delivering Transformation Work Programme. Now that's followed last year's policy shaping activity around paying for care and guidance on pooled budgets, with a focus on rebalancing the care sector and enhancing opportunities for cooperatives and third sector to deliver more care and support. We have got a couple of work streams. ADSS has developed a couple of work streams on the DTG. One is considering the rebalancing of adult and children's care delivered by local authorities, private providers and the third sector. It's covering residential and domiciliary care for adults, children and fostering and adoption. And the other work stream is mapping cooperative provision and exploring how this can be increased, including the use of pilot projects and toolkits. You will see in your delegate pack you'll find a couple of forms and there's a few questions on each of these. Please take a chance to contribute to the research. We really do want to hear what you think. It's important that you're able to contribute to this, and we want to hear from as many people as possible. So take a look in your pack, and when you're having a cup of coffee, fill out those forms. They're both really important pieces of work. They've been prioritised as key policy objectives by the First Minister, Mark Drakeford. The fragility of our care market continues and was exposed last year when allied healthcare was on the brink of administration. At that time, our members reacted quickly by working with Welsh Government and other partners to minimise the risk to service users, as well as providing support to allied care workforce. So it's clear that the wider market needs strengthening, and I know these two pieces of work will assist local and national government make important decisions about commissioning arrangements in the future. ADSS have also been involved in a whole range of other work. They've been involved with the regional partnership boards, the National Fostering Agency, the National Adoption Agency, the National Commissioning Board, with various Brexit preparedness groups, and I wasn't going to mention that word, so I'll move on quickly, with Cafcas Cymru and work around the family justice system. So our members who put themselves forward to lead or be involved in these pieces of work do so on top of very busy day jobs, of leadership jobs, and leading operations. And I'm very grateful to all colleagues in ADSS. We should be collectively proud of the work our members do every day. Social care in Wales is facing huge challenges, but where there is a challenge, there is also an opportunity. And through the further integration of health and social care, we can make more progress. And by working together with the proper resources, we can continue to strive for a revitalised health and social care system fit for the 21st century. Let's make that change a reality. Thank you.